Zimbabwe Ministry of Health authorities say that cholera has claimed 28 lives since the end of April. Nearly 400 cases have been confirmed and more than 1,400 cases are suspected. Health organizations such as the Zimbabwe Association of Doctors for Human Rights blame the outbreak on the consumption of unsafe drinking water and the flow of sewage in some areas. Jacob Mafume, the mayor of Harare, says he is aware of drinking water and sewage problems.
We are responding to sewage issues as soon as we get a report on them. We are also increasing the water flow. We are also going to take advantage of the polio vaccination to vaccinate against cholera because most of the people who are getting this cholera are unvaccinated people.
Zimbabwe received heavy rains this year and most of its water sources are full. But clean water for drinking and household use is not getting to most citizens' homes because of power cuts and shortages of water treatment chemicals. Fanuel Mushonga says he has not had tap water in his home for 3 weeks. He says he is lucky to have a manual borehole nearby.
If I could get a chance to talk to leadership, I would plead with them to train our students studying to be engineers so that they could pump water from Lake Chivaro to the people in townships, and also to procure water treating chemicals so that people drink safe water.
Citizens should practice good hygiene and the government should do more to treat water and inform citizens, says Dr. Norman Matara, Secretary General of the Zimbabwe Association of Doctors for Human Rights.
We urge the government to continue the surveillance that they've been doing over the past weeks and over the past months so that we detect new epicenters of cholera outbreak. We also urge the government to continue with mass media awareness on the cholera outbreak and on ways people can prevent this cholera outbreak within their homes.
The World Health Organization says the extremely virulent disease is now in 13 African countries. Dr. Otim Patrick Ramadan is the World Health Organization's Regional Health Emergency Officer. He says that hygiene is not enough and that governments must provide clean water and hygienic facilities to eliminate the problem.
That is something that requires a lot of investment and that governments need to proactively work on. Then the second one, of course, is also addressing issues of hygiene of food at the community level, at the household level, and then working, because we have communities or areas where cholera has been endemic, and we need to have targeted interventions in those areas.
In 2008 and 2009, a cholera epidemic killed more than 4,000 people in Zimbabwe. According to a US report, the crisis was exacerbated in part by the politicization of water, health, and aid. Columbus Mavunga for VOA News, Harare, Zimbabwe.